Health Matters is sponsored by Bon Secours.
October is Breast Cancer Awareness Month, and each year more than 260,000 women will be diagnosed with breast cancer. More than 40,000 will succumb to the disease. Joining me now is the Director of Breast Oncology at Bon Secours Richmond, Dr. James Pellicane. So, Dr. Pellicane, tell us about the signs and symptoms of breast cancer.
Well, one of the symptoms of breast cancer, of course, is a breast lump that a patient might feel in her breast. However, it's not always the only presenting symptom or the first presenting symptom. Oftentimes we find symptoms or find signs on screening mammograms, which patients should really start getting at age 40 if they have no family history of breast cancer.
And speaking of family history, talk about the role that can play in someone's risk for breast cancer.
So family history is important, but it's not the most important thing that we see in a patient's risk profile. About 80% of women that develop breast cancer don't have a family history of breast cancer. So we see this, especially during COVID, where women are a little afraid to come into the hospital to get their screening mammograms, and they think because they don't have a family history, they can skip a year or two, which is not necessarily a good idea.
And finally, tell us about the research happening right here.
We have a very robust research program at Bon Secours. We have clinical trials open across multiple cancer diagnoses and multiple breast cancer trials that are open too for our patients.
Awesome. Thank you so much for chatting with me. If you want more information on the Bon Secours Breast Health Team, go to bonsecours.com.